In medical school, I was frustrated by the lack of caring in our education and our institutions. And so I co-edited a volume of stories by women called Women Who Care. When I finished medical school and I started residency, training to be a family doctor, my perspective shifted from being a student to being a practitioner. And also, my own personal experiences had led me to be quite frustrated with the mental health care system. As a family doctor, I spend my days making referrals for adults, for youth, and for children to be seen by psychiatry at one of the hospitals in Ottawa or in the community, and I'm every day met with the response that your patient isn't severely sick enough. So I'm faced with the question, how do I explain that to my patients? Or I'm told, due to overwhelming volume, we're not accepting any referrals right now. There are no psychiatrists in the community in Ottawa who provide psychotherapy who are accepting patients. Their practices are all full. Our healthcare system only offers diagnoses and medication. We don't provide, we provide emergency services, crisis interventions, but we don't provide any help to address the psychosocial issues that contribute to mental health. We don't address social isolation, poverty, hunger, lack of housing, experiences of alienation and discrimination, addiction, emotional abuse, sexual abuse, physical abuse, chronic childhood trauma. Most psychiatrists and psychiatric institutions don't provide trauma therapy. So we're stuck with a multi-tiered system in which those people who have need can only get the care if they can pay out of pocket. In Ottawa, that's $200 an hour with a private psychologist. Most of my patients don't have the means. So this book was written partly out of that frustration. We also know that in First Nations, Inuit, and Métis communities across Canada, we lock people away in jails rather than addressing the devastating effects on mental health of colonization and the history of Aboriginal residential school systems and systemic racism. In the broader population, how many people have experienced the traumatizing overlap between the police and mental health services? How many people daily are handcuffed and roughly brought by police to locked psychiatric wards? We have a Facebook site for our book, and the most likes, links, hits, and shares came from a post that I posted of a bruise from somebody being thrown on the floor and handcuffed by police because of depression and asking for help. Many, many more people were interested in images of that physical bruise than of hearing people's stories. On psychiatric wards, where are the social workers? Where are the therapists? In Ottawa, there are no social workers, there are no therapists. I was told by the psychiatrists that's something that I could advocate for, but it isn't happening. It's a dehumanizing experience to have one's clothing and shoes replaced with a hospital gown. Hospital staff may not be aware that they avert their eyes, but patients notice that nobody will meet their gaze. So how can people heal when they're made to feel so vulnerable, when they're stripped of their voices and their dignity? How is this care? We each have our own stories. My colleague, Lori, and I asked people to take a risk and share their experiences. Not all of them are negative. This book is unique insofar it gives voices to people's lived experiences as patients, as caregivers, as healthcare providers. These are their stories of their childhoods, their families, their workplaces, and their encounters with the mental health care system. Some of these stories are celebratory, and other stories give us a painful glimpse into the dark periods in people's lives. So we're honored that women entrusted us with their stories.